In this video, we're going to discuss AMA documentation. So first of all, we must define what AMA means. AMA stands for Against Medical Advice. The definition of against medical advice is a term used in healthcare institutions when a patient leaves a hospital against the advice of their doctor. However, we are not doctors, we are EMTs and paramedics. However, the term still applies in that we recommend something to the patient and they go against or they refuse our recommendations. Now, I want you guys to pay attention to the key word there, refuse, and we're going to talk about that refusal here throughout this presentation. So this is what our AMA form looks like. And the AMA is a form used if a patient refuses any kind of medical care. Once again, we see the term refuses. Examples include the patient refuses transport to a hospital, the patient refuses a medical procedure, the patient wants to go against the advice of medical personnel, or the medical provider feels that an AMA should be filled out. This is why we would fill out an AMA. And like I said, pay attention to that word refuses. The patient must refuse something. Now, what is something common that patients refuse? A lot of times it's ambulance transportation, meaning that if we're working a call and we say, hey, I recommend you go to the hospital by ambulance, now we go ahead and the patient says no, now we have grounds for that refusal. So what does an AMA do? An AMA does one of two things. It releases an agency from legal liability when medical recommendations are made, and it informs the patient of the risks and benefits of refusing treatment from a healthcare provider and or ambulance transport. When does an AMA need to be filled out? AMAs need to be filled out anytime a recommendation is made to a patient in regards to medical treatment and or transport to the hospital by ambulance, meaning that we recommend something to the patient and they refuse that recommendation. Could be anything. I recommend you go get stitches. I recommend that you go to the ER. I recommend that you take an ambulance to the hospital. Doesn't matter what it is, they have to refuse something, which then makes it grounds for an AMA. The other time that we want to fill out an AMA or document an AMA is when we have a high liability case. High liability cases are anytime a patient states that they slipped or tripped and fell to the ground. Trips, slips, and falls are a huge area of legal concern. And what we're doing here is we're making sure the patient has all available options when making their treatment decisions. So trips, slips, and falls are a big area of legal liability. Oftentimes, these patients refuse medical treatment initially and seek it days later. And this couldn't be more true. We've had numerous cases here at Guardian that have requested paperwork or taken our venues to court or started a legal process because many days later they still weren't feeling better, even though at the time of the incident they didn't want any help. Many slips, trips, and falls end up in a courtroom many years down the road, even when the patient initially states that they are not interested in seeking medical care or if they are not interested in seeking compensation for an injury. Once again, it's important that if we come up to a patient, we say, hey, are you okay? Let me go ahead and assess you. And they say, no, I don't want you. We get that AMA documentation to show that we try to render aid. Therefore, it's imperative that any patient who slips, trips, and falls must have an AMA and a PCR filled out if the patient does not seek treatment. Even if the patient has a minor complaint, whether it's medical or trauma, if they state they slipped, tripped, or fell, then we have to have an AMA filled out because we have to make that recommendation that the patients be evaluated in an emergency room. And once again, this is simply because of the legal liability associated with slips, trips, and falls. I can't emphasize this enough. All slips, trips, and falls must be documented. So now this brings us into who can AMA and who is a candidate for signing out against medical advice. So any patient can AMA who is an adult or a rational teenager in a low-risk situation, meaning they are 18 years of age or older, or they're under 18, they're between the age of 13 to 18, so they're a teenager. They're rational, meaning they can answer all your questions, they're thinking appropriately, and they are in a low-risk situation. And they also must have decision-making capability. Three things that I look for when talking about decision-making. Let me take that again, guys. Three things I look for when talking about decision-making capability is the patient ANO times 4. Does the patient have a GCS of 15? And this is the big one. Is the patient able to follow simple instructions? We're going to talk about here in a few minutes when we talk about filling out the AMA, the patient must actually legibly write on the AMA form. Once again, following simple instructions. Yeah, we've had patients that can answer our questions, they've got a GCS of 15, but you tell them to sign their name and they cannot sign their name, or they can't write a simple sentence. These patients are not candidates for an AMA and must be evaluated in an emergency room. So what we see on the screen now is taken directly from the Southern Nevada Health District protocols. And this is a flow chart talking about whether or not patients can AMA and what has to go into every AMA form and documentation. So we see that if we have a patient that doesn't want to go with us, we want to go ahead and describe the plan of treatment and tell them, hey, look, I recommend that you go to the hospital by ambulance. They're going to go ahead and start an IV on you. They might give you pain meds, and you seek treatment in an emergency room. If the patient agrees, then we go ahead and initiate care. We don't have anything else to do. We treat the patient like normal. However, if the patient does not agree, we have to evaluate their judgment-making capability. So we want to go ahead and suspect a compromise in judgment in the presence of a life-threatening condition. If they do have a life-threatening condition, then we want to go ahead and initiate care under implied consent. However, if they are ANO times 4, they got a GCS of 15, and they're able to follow those simple directions, then we want to go ahead and evaluate the patient, see if they're an adult or an emancipated minor that has decision-making capability. If the answer is yes, then we go ahead, explain the risks, and document the specific risks of refusal. One thing to point out, we're going to explain to the patient, this is what can happen to you by signing out AMA. Make sure they understand those risks. And then on our patient care report, we have to document exactly what we said to the patient. In that we advise patient that their condition could get worse and they could die. Patient states they understand all risks. These are things that we need to document in our AMA. In addition, we also want to try to help, see if we can get the help of others, whether it's family, police, medical control, etc. And then we go ahead and have the patient sign our waiver, and then we continue with our documentation efforts. However, if the patient does not sign the waiver, then we need to go ahead and make sure we clearly document on our patient care report that we try to get the patient to sign the AMA and all efforts made to get the patient to sign. Now we're going to go back over talking about what happens if the patient is not an adult or is not an emancipated minor. We want to go ahead and see if the guardian is available and try to make contact with the guardian. If the guardian is available, we go right back to the beginning and we go down the treatment plan and we explain to the guardian what's going on and see if they agree to care. If we cannot get the guardian, then we're going to go ahead and see, is the patient a rational teen in a low-risk situation? If the answer is no, then we go ahead and initiate care under implied consent. If the answer is yes, meaning that it's a rational teenager, so a teenager between the ages of 13 to 18, that they're able to answer all of our questions, that they're in a low-risk situation, so like low trauma or minor medical complaint, then we go ahead and have them sign the waiver. Now, I just want to reiterate, it's important to make sure that regardless of what we do, we document everything that happened and everything that was said on our patient care report and try to make sure that we use quotes whenever possible. So why do patients AMA? Patients AMA for one of three reasons. The first one is they have obligations, okay? Meaning that they cannot break away from those obligations. These may be family issues, work issues, social issues, or any other kind of obligation that the patient feels that they cannot give up to go seek treatment. Another reason is the cost. Yes, medical care is expensive. Ambulances are expensive. But the thing is that we should be focusing on the patient and not the cost. And lastly, denial. Patients oftentimes are in denial about their condition, meaning that they don't believe that it's as bad as they think it is. So now we're going to get into actually seeing what an AMA looks like and what an AMA is. So we're going to take a moment to go ahead and read the wording in an AMA form. So this is what the patient is saying they understand. So paragraph 1, I or my guardian have been informed of the reason I should go to the hospital for further emergency care. Paragraph 2, I or my guardian have been informed that only an initial evaluation has been rendered to me and have been advised that I seek the advice of a physician as soon as possible. Paragraph number 3, I or my guardian have been informed of the potential consequences and or complications that may result in my or my guardian's refusal to go to the hospital for further emergency care. Number 4, I or my guardian, the undersigned, have been advised that emergency medical care on my or the patient's behalf is necessary, and that refusal of recommended care and transport to a hospital facility may result in death or imperil my or the patient's health by increasing the opportunity for consequences or complications. Nevertheless, in understanding all the above, I or my guardian refuse to, and the patient or guardian must check one of these boxes. Either they refuse to accept emergency care, accept transport to a hospital, or accept transport to blank hospital as directed by Southern Nevada Health District EMS protocols, but request transport to another hospital, and that the patient assumes all risks and consequences resulting from my or my guardian's decision and release Clark County provider agencies and all personnel directly or indirectly involved in my care from any and all liability resulting from my or my guardian's refusal. I have had the opportunity to ask all questions I feel necessary to provide this informed refusal. And then lastly, number 5, we have the patient write a simple sentence as to why they are refusing care. So this is what the patient is refusing. This is what they're signing for, that they understand all these paragraphs. So now we're going to talk about actually filling out the AMA and what goes into documenting and what needs to happen on the AMA form. So first we're going to start at the top of the AMA. At the very top of the AMA, we need basic patient information, including their last name, their first name, their date of birth, their address, and their phone number. You'll notice that it also says on here that the crew fills out the following information. I'm not a big fan of having patients fill this out because oftentimes I can't read patients' handwriting. I can read my own, I can read my partner's. If I can't read my partner's, I can look to my partner and say, hey, what does this say? But once that patient is gone, if I can't read their handwriting, I don't know what it's going to say. Next up, we have to have the patient fill out sections 4 and 5 of the AMA. We see here that in section 4, the patient must check one of those boxes stating what they are refusing, meaning the patient must check what care or what they don't want to have happen. I mean, they don't want to accept emergency care or they don't want to have transport to a hospital facility. Oftentimes, patients are going to check one of these 2 boxes. Rarely do they check number 3. Number 3 more pertains to a transport agency, meaning that our protocols say that a patient has to go to X hospitals directed by protocols, but the patient wants to go to Y hospital. An example would be, let's say, a stroke. We have designated stroke facilities. Well, if we have a patient having a stroke, by protocol, we have to go to that stroke facility, but if the patient's ANO times 4, GCS of 15, and is able to follow simple directions, then, and that patient wants to go to a non-stroke facility like North Vista, we have to take that patient to North Vista, but we have them signing, understand that they want to go to a different hospital. The next thing the patient must fill out is section 5. This is a simple sentence as to why they do not want to go to the hospital by ambulance. The patient must write a legible sentence explaining why they are refusing treatment. The sentence must have some kind of substance as to why they do not want treatment. For example, writing fine or okay is not acceptable. The patient must write a legible sentence explaining why they do not want treatment. Now you'll see here, I really focus on that legible part, okay? We've had patients that are intoxicated or on drugs that are able to follow our instructions and they just scribble something and saying that's why they don't want to go. Can't have that. They have to be able to write something down legibly to demonstrate why they don't want to go to the hospital. Patients who are unable to properly fill out the AMA are not considered to be mentally sound and must be transported to an ER for further evaluation. So we see here are some good examples of what can be written in paragraph 5 by the patient. So we see here, I do not feel as necessary. My boss is taking me to Sunrise Hospital. I would rather go back to the hotel and sleep. I want to see how I feel in an hour. I would rather go to urgent care. All great examples of why the patient is signing out AMA. Here are some bad examples. You see the word fine or okay. Can't have that. They have to write something. Or the patient doesn't write anything at all. Or lastly, we just can't read what the patient wrote and it's unintelligible. I'll tell you from experience, I had a couple of intoxicated individuals do what we see on the screen in the last part. And unfortunately, we have to transport these individuals to the hospital. And the last thing for the patient to fill out is going to be their signature. They must sign their name. This AMA is not valid if the patient does not sign their name in the signature box. Now, as a tip, with the AMA form that we have, the patient fills out everything in gray. So if it's a gray box, that means the patient is responsible for filling it out. Now you'll notice next to the signature box, there is a refusal to sign checkbox. And what this is in the event that you can't get the patient to sign. So you go up to a patient, they say, no, I don't want to sign, or they walk away, or they're belligerent, whatever the case is, then we go ahead and we check the box showing that they don't want to sign. If the patient refuses to sign, we must make every effort to get the patient to sign the AMA. However, don't place yourself in jeopardy or in danger. Just go ahead and, if it's getting to that point, back away. However, if the patient still doesn't want to sign, then we check that box if the patient refused to sign next to the patient's signature box. Then we complete the rest of the AMA to the best of our ability, and then on the patient care report, we document all our efforts that were made to get the patient to sign the AMA. You'll notice at the bottom of our AMAs is a spot for additional notes. This is optional, but it's very helpful for documenting calls. Reason why this is helpful is because the AMA is a carbon copy, meaning that it comes with a yellow and white copy that as you write it, it's making a copy on that yellow form. This means that you can easily tear that off and give it to the patient, or if you do end up calling for additional transport, you have everything documented at the bottom of your AMA for pass down notes. It's also helpful for patients at AMA because they can take what you wrote and take it to their physician. So if they have high blood pressure or if they have something else going on, the physician or their medical provider can see some notes that we wrote for the practitioner to help get the patient better. Once again, this optional notes at the bottom is optional. You don't have to utilize it, but it is very helpful for documenting your calls. And just a recap of the AMA, this is everything together. We see that everything in green is what GEMS personnel have to fill out. Everything in purple is what the patient is reading and understanding that they're signing AMA. If it's in red, that means that the patient must fill it out. So those are like our gray boxes that we discussed earlier. And then if it's yellow, then it's optional. We don't have to fill it out. I discussed earlier that the AMA is a duplicate carbon copy. It comes in a white and yellow form. As you write on the white form, it transposes it to the yellow form. The white form is the original and must be maintained in the custody of Guardian Medical Services at all times. We are not to give the white copy to anyone for any reason. The yellow copy is used to give to the patients. Okay? We usually tear the yellow copy off and hand it to the patient. This can be given to any official who requests it and is involved in patient care, so like fire department, private ambulance, law enforcement, security. Sometimes they will request the AMA, or we can give that to the patient. So now we're going to shift gears, and we're going to talk about actually documenting the patient care, or documenting an AMA on a patient care report. So the following must be documented on our patient care reports when we're talking about AMAs. So we want to make sure that we document our proposed plan of treatment, that the patient clearly refuses that treatment plan, The patient has been advised of all risks and benefits of the treatment plan, up to including worsening their current condition and death. The patient understands that their condition could get worse. The patient signing the AMA and any recommendations made to the medical staff, or made by the medical staff. So I've got some good examples here of AMA documentation. Now, mind you, during these examples, we're only going to look at the actual AMA documentation and what went into specifically the AMA. So we see here that in the AMA documentation that the patient refused transport by ambulance, so we see what recommendation was made. The patient going to Sunrise ER with shop steward for immediate evaluation, meaning that the patient's going to seek follow-up care, and the patient signed AMA. Could we put a little bit more into this? Absolutely. We could put things in like patient understands that their condition will get worse, patient accepts all risks, things like that. But for the most part, this is a pretty good AMA documentation. Here's a second one. We see here that in the plan that it was clearly documented as to recommendations that were made. So told patient to drink plenty of H2O throughout the day, 8 bottles to be exact. Then we recommended the patient go to the hospital. Patient refused ambulance transport and signed AMA. Once again, yes, we could put a little bit more into it, such as patient advised to seek treatment and transport to a hospital by ambulance. Patient states that they don't feel it's necessary. Patient advised that their condition could get worse. Patient states all risks. I mean, we could put all that in there if we want to, but for the most part, this AMA is fine. We see here that this AMA, although handwriting is a problem, all right, so if we had an issue, we have to go back to this crew. We see here that the actual underlying documentation is good because it clearly states what was possible with the patient, possible puncture lung, internal bleeding. The patient still wants to sign AMA and will take self to the ER and documents the signing of the AMA. Once again, this could be strengthened by specifically documenting that ambulance transport is being recommended, but we see that regardless of that, still a pretty solid AMA in that recommendations were made and what could be wrong was documented. Here's another good example. So this is a good example because it was documented the patient was advised of all risks and benefits of refusing transport, and it was documented the patient would go later if she felt worse and boyfriend was driving. This could be improved specifically by documenting that the ambulance transport and evaluation in the ER was being recommended. Now we're going to shift our gears and let's talk about some bad examples and why these are bad examples. So with this one, we see here that the provider simply wrote patient signed AMA and chose to return to hotel. The reason why this is a bad example of an AMA is because it doesn't talk about the treatment plan and what was proposed. Was it proposed patients get stitches, that they seek evaluation in the ER, that they take an ambulance? We don't have any of that, so we need to go ahead and make sure that we clearly document what recommendations were made to the patient. Here's another one. Patient signed AMA, stated was feeling better. Nowhere in here does it discuss what was recommended to the patient or what the treatment plan was or what the proposed treatment plan was. All it says is that the patient signed AMA. But what were they signing AMA against? Remember, the patient must refuse something, and we have to document that refusal. We have to document that the patient does not want to go to the hospital by ambulance, although it is recommended. We have to document those specific refusals and the specific treatment plan the patient is not wanting. Here's another one. ABCs assess, vitals reassess, and patient sign AMA. This goes back to the previous example. That treatment plan, that proposed treatment plan is not being documented. We do not see what was recommended to the patient and that the patient understands the risks of signing AMA. And this is very similar, that all they wrote was that the patient signed AMA, nothing else. We don't have those proposed treatment plans. We have to document those proposed treatment plans. So remember, patients are refusing a specific treatment plan, and this treatment plan they are refusing must be clearly documented on the AMA. Oftentimes, the treating plan may be as simple as transport to an ER or calling ALS. So saying to the patient, hey, I recommend you go to the hospital by ambulance, or you know what, I think that we need to call some paramedics here to have you further evaluated. If the patient says no, now we have grounds for an AMA, and we must document that. Therefore, in summary, the following must be documented on the AMA, or correction, on the patient care reports when documenting an AMA. We have to document the proposed treatment plan. We have to document the patient clearly refused the treatment plan. We have to document the patient has been advised of all risks and benefits of the proposed treatment plan, up to including worsening their current condition and death. The patient understanding that their condition could get worse. The patient signing the AMA, and any recommendations made to the medical staff or made to the patient by medical staff. This brings us to the end of our AMA lecture. If you have any questions about it, please make sure you reach out to the on-duty supervisor.